Over the past 8 years, FONAL has been striving to improve the quality of life of Haitian people through integrating persons with disabilities into society, as well as working through the prevention of physical disabilities. We've seen that two essential elements are needed to support those who are disabled. Firstly, medical treatment that maximizes their ability to function in society. Secondly, believing in the intrinsic value of all human beings as creations of God, we provide advocacy, which gives those with disabilities more inclusion in their community. Dr. Evans began FONAL from a small room 2 meters long by 3 meters wide, which was just enough space for a bed and to examine patients. In the years since, FONAL has expanded and now offers a more all-inclusive range of rehabilitation services. Each month, FONAL provides over 750 consultations and treatment sessions to the most vulnerable people through a pluridisciplinary team in clinical settings: physical therapists, occupational therapists, speech therapists, nurses, and counselors, in addition to supported materials such as wheelchairs, walking canes, crutches, walkers, and braces as needed. In addition, the work at the clinic arranges home visits to treat 30 patients each month who are not able to leave their homes. The family members are trained to be involved in the patient's recovery. Homes are adapted to increase patients' autonomy and participation in making decisions within families. Fighting exclusion is the biggest challenge for disabled people in Haiti. FONAL saw that disability itself was only part of the problem, with attitudes towards disability dominated by ignorance and suspicion, leading to persons with disabilities being seen as having little value and as a burden. This drove the second element of FONAL's mission, which is inclusion, ensuring that persons with disabilities are full citizens, claiming the rights to which all are entitled. We conduct awareness campaigns on inclusion and the respect of rights of disabled people in schools, churches, and communities to change negative attitudes towards people with disabilities. However, accessibility remains a big challenge for inclusion in Haiti. To solve this issue, FONAL builds ramps and makes public and private infrastructures accessible to everyone, while foreman and masons are trained on accessibility standards and inclusive practices. We trust that a better life is possible in Haiti as we continue to overcome the challenges. That's why FONAL runs the Economic Empowerment Program, targeting the most vulnerable, disabled people, and single mothers, helping them to create businesses and become self-sufficient economically. You have heard about economic poverty, natural disasters, difficult social and political environments, but those only tell part of Haiti's story. It is also a place rich with diverse culture, a country with talented, hardworking, resilient people. FONAL offers this disability prevention and maternal-child health program to reduce the cases of disabilities among children, youth, and adults in Haiti. Currently, stroke, road accidents, and cerebral palsy are the leading causes of disabilities in Haiti. Rehabilitation care is essential to address the loss of productivity. There are cases of victims of the 2010 earthquake who are still not fully recovered physically and are therefore not able to earn a living. This is an example of the urgency for rehabilitation. This prevention program focuses on those three major causes of disability in Haiti. Number 1, prevention of stroke. Stroke victims represent an average of 57% of patients that we treat each month, with most of these individuals being women. We are educating communities about the main causes of stroke in Haiti, high blood pressure, and type 2 diabetes. We are orienting them to a balanced diet with a reduction of salts and oil, which is often found in many Haitian foods. We also encourage more regular exercise. Number 2, prevention of road accidents. Making the population aware of road safety procedures such as the use of helmets. Number 3, maternal and child health. Over the last 8 years, paralyzed cerebral palsy patients who seek treatment at FONAIR are mostly from teenage mothers, adolescents, and mothers who have not follow-up medical care before, during, and after pregnancy. This program informs adolescents of measures to prevent teenage pregnancies and other dangers related to sex. Boys wearing condoms and girls using contraceptives. Women of childbearing age will be trained on the importance of pre, during, and post-pregnancy medical follow-up to prevent any health complications that may lead to a baby's birth defect. In addition, they will be informed of the importance of postnatal medical monitoring and vaccinations. Finally, the mother will be educated in the motor and psychomotor development of the child for early detection of possible deficiencies that could lead to disabilities. This program is created to leave no one behind in disaster relief, as well as to coach local authorities and NGOs to apply inclusive warning systems and disaggregated data in emergency and humanitarian response. To illustrate, after Hurricane Irma 2017, we reached 6,200 people as direct beneficiaries, including 1,609 women, 1,646 men, 2,240 children, and 705 people with disabilities through 4 inclusive interventions: food and hygiene kits, mobile clinic, home repairs, and income-generating activities. We advocate against violence to women, children, and people with disabilities in general. This is an ongoing program in FONAIR with opportunities scheduled throughout the year to interact with the public on matters of this concern. The success of FONAIR is our Haitian staff. They are therapists, nurses, psychologists, social workers, administrators, drivers, and others. Our programs are running from Haitian perspectives. We have 21 staff, and 7 of them, which is 33%, are individuals with disabilities, assisted by foreigner volunteers and intern students. Our long-term vision for Haiti is, number 1, a better quality of life for disabled children. Number 2, healthy families. Number 3, inclusive, resilient society. Number 4, providing the resources to promote flourishing communities. In December 2017, FONAIR received the Accessibility Award for its efforts in this area. We have transformed a large number of institutions to be handicapped accessible, in addition to changing negative societal attitudes towards people with disabilities. In July 2018, the United Nations, UNOCHA, presented FONAIR as a model for inclusion at the World Disability Summit in London. In November 2018, in a survey conducted by the international organization NEAR, funded by the Bill and Melinda Gates Foundation, FONAIR has been chosen as a model towards localized, inclusive humanitarian action around the world. In December 2018, Fonale was invited by the United Nations, UNOCHA, and participated in the Global Humanitarian Policy Forum at the UN headquarters in New York. Join us to celebrate the next 8 years of making a difference.